Hello again, everyone, and welcome to another Health Minute brought to you by Wellpoint. Wellpoint, formerly Unicare, they're changing to Wellpoint on July 1st of this year, 2024. But despite the new name, same commitment to Massachusetts and the same commitment to their members' whole health. Thank you to Wellpoint for bringing you this Health Minute, and thank you to them for also helping bring you all of our Inside Lowell podcasts and all of Inside Lowell for that matter. Also want to take a quick minute to thank Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank. Boston North Company, business solutions to help restaurant and retail clients save money. That's going to make your business more profitable. Who doesn't want to do that? So get to Boston North today. Mahoney Oil Company, providing warmth and protection to Greater Lowell and Southern New Hampshire since 1925. That's nearly a century. That's Mahoney Oil. Francis E. Preventure Insurance Agency for auto, home, business, and life. Trust the insurance agent Greater Lowell has trusted for 40 plus years. Francis E. Preventure Insurance. GoPuff, a grocery store right at your fingertips. Great idea and great offer. Use the code Lowell20. Save $20 off your first order of $21 or more. You'll even get free delivery. So get on over there and download that GoPuff app or visit gopuff.com today. And last but certainly not least, the Massachusetts Pirates. It's February. They're kicking off their season next month. Home opener, March 23rd at the Tsongas Center. So catch all the action and excitement of arena football by purchasing your tickets today. Visit masspirates.football.com. And with that, we bring Dr. Carolyn Langer here on to our Health Minute. She is the medical director at Wellpoint. Welcome, Dr. Langer. Great to have you here.
Thank you, Teddy. Great to be back.
It's always good to have you. I learned so much, and I gotta have a hunch I'm gonna learn an awful lot this month as well. February is Heart Month. Kind of highlights how important the heart is to your body and to your health, because it gets its own month. I don't know any other organs that get their own month, but why is the heart so important to people's overall health?
Well, you know, Teddy, your heart works so hard for your body every second of the day, and it's important to keep it healthy for your whole health. Sometimes the heart doesn't always show physical signs until it causes a bigger issue, such as heart attack or stroke. But the body has other ways of telling us when something's not right. So it's important to monitor certain measurements with your physician, such as cholesterol, blood pressure, blood sugar, and body mass index, or BMI.
Why blood sugar? I get the others. I get the cholesterol, right? Clogs your arteries where the heart is pumping your blood. Blood pressure, obviously, even my inflated body mass index. The blood sugar part I don't get, though.
Well, blood sugar and diabetes are a major risk factor for cardiovascular disease, just like high cholesterol and smoking.
Aha, that's something I learned there. So what are some of the screenings that are available that your health professional will use to see what exactly is going on in there in your ticker?
Well, there are three common first-line tests to check for heart disease. One is the exercise stress test. This can involve the same electrodes and recording equipment that are used in standard EKGs, except that you'll be walking on a treadmill or pedaling on a stationary bike instead of lying down. And your doctor will use it to follow up on symptoms like chest pain, to look for abnormal heart rhythms, and determine if you need more testing. There's also a test called the echocardiogram. This test is an ultrasound of your heart. A technician moves a wand-shaped device across your chest, and the device uses waves to produce a moving image of your heart. This might be done twice while resting and after exercise to see how your heart performs under stress. And then the third test is called a cardiac CT for calcium scoring. So a computed tomography or CT scan is like a full-body X-ray taken while you lie on your back in a box-like machine. And X-ray cameras rotate around the machine's interior, capturing images. This particular CT scan checks for the location and amount of calcified plaques in your coronary arteries, which can sometimes signify the potential risk of future problems.
So how do I know when it's time to get one of these screenings? Because people usually wait too long, right, to get one of these. What are some of the things that I should, be aware of and get ahead of it rather than waiting till it's too late?
So, the most important thing is to go for regular preventive visits with your primary care provider. In terms of these specific cardiac screening tests, it's really going to vary based on the individual and their own risk factors, family history, and so forth. That's why it's important to have that discussion with your PCP.
So are there times where screenings aren't necessary?
So, for other people, screenings are not always necessary. Some screenings tests can cause problems like bleeding, infection, and even false positive results. These false alarms can certainly lead to unnecessary worry and potentially harmful tests. That's why it's important to talk to your doctor. But for some individuals, heart screening tests may be indicated. They are important preventive and diagnostic tools. Again, this is something that should be discussed with your physician. So, for example, when you're having symptoms of a heart attack or other cardiac conditions, if you have a family history of heart problems, if you have certain conditions like those risk factors we mentioned earlier, high blood pressure, diabetes, these can all impact cardiac health. And finally, if you are currently a smoker or have been a heavy smoker in the past, those would all be important reasons to discuss heart screening with your primary care provider.
I guess with most areas of health, the best way to avoid the complications and the problems that arise with them is to prevent them in the first place. So you mentioned smoking, right? Don't smoke. That
Right.
probably goes for every component of health,
Right.
right? What are some of the other things that you can do to help keep your heart going for as long as possible without needing any care?
Sure. So, and by the way, with respect to smoking, we've talked about it a little bit already, but there really is no such thing as a safe tobacco product. Every type of smoking, even secondhand smoke, increases the risk of heart disease and heart attack. So the good news, though, is that if you do smoke, quitting now can still make a huge difference. So that's why it's important to talk to your doctor about support programs or products that can make it easier to quit. But there are other very important things you can do, such as building a healthy diet. Eating right helps you control heart disease risk factors, the risk factors we mentioned before, high cholesterol, blood sugar, blood pressure, weight. Try to build your meals around mostly fresh, nutrient-rich foods, such as fruits, veggies, whole grains, low-fat dairy, lean meats, nuts, legumes. Try to limit salty processed foods, alcohol, red meat, and sugary drinks and desserts. There's some other things you can do from a preventive standpoint. Exercise regularly. We talked about that a little bit in some of our earlier sessions. But regular exercise lowers the risk of developing high blood pressure, high cholesterol, type 2 diabetes, and being overweight. So try to aim for at least 2 hours and 30 minutes of moderate aerobic exercise each week, something like brisk walking or biking. That comes to about 30 minutes, 5 days a week. And then finally, some other things you can do are just, we talked about whole person health, and it's important to think about your emotional and mental well-being. So try to really limit your stress levels. And I know this is easier said than done, but some people do cope with stress by overeating, by drinking, by smoking, and these can all increase the risks of heart disease. So finding healthy ways to deal with stress can really improve your mood and your overall health. So try things like meditation, therapy, breathing exercises, working out.
It's funny, you almost gave me a heart attack, pardon the pun, when you said exercise 2.5 hours, and thankfully you added the in a week instead of in a day. But it's really that simple. If you Commit 30 minutes a day.
30 minutes a day.
There you go. You don't even have to do every day. But you also, you don't need to be out there running a marathon and pumping iron like Arnold Schwarzenegger. Just
No.
a brisk walk will do the trick.
Just a brisk walk down the street. Walking from, if you're commuting to work by car, walking from the parking lot to your workspace. They're small ways. You don't have to belong to a gym. You can just set up a brief exercise routine at home several days a week.
You know, it's funny. Some of these things, I'm starting to sense a pattern here. Healthy diet, exercise regularly, and try to reduce stress. Amazing how every component of health, whole health, those three little steps there, and we'll throw in don't smoke or do anything else that harms your body intentionally, makes a difference in your members' health. Huh?
Yeah, and as we talked about a couple of months ago, set small, realistic goals, incremental goals. Don't try to do it all at once.
Baby steps. I love it. Dr. Carolyn Langer, thank you as also for joining us. Very important, very informative session.
Thank you for having me here today, Teddy.
Thank you. And thank all of you for joining us as well for this Health Minute brought to you by Wellpoint, formerly Unicare. We'll be back with another Health Minute next month. Till then, everybody stay safe.